Prior to injection of the nasolabial folds, a topical anesthetic is used. This patient has grade 3 nasolabial folds on the Lemperle scale. The right side is slightly different from the left and does not require as much injection. At the alar base, a fanning technique is used. The needle is inserted and then a series of linear injections are performed from near the alar base along the nasal sill, superiorly towards the nose, and as the syringe is inserted and withdrawn, hyaluronic acid is deposited, generally on withdrawal. The lower nasolabial fold also needs to be injected, and as you can see, there are different levels of atrophy of the soft tissues and of sagging. Again, a linear threading technique is used in this area, and massage is necessary to smooth out any isolated accumulations or deposits that would cause an irregular bump. Notice then that the perpendicular injection is used to also smooth out the various areas. The injections are at different depths in order to build up a layer of soft tissue support. The inferior nasolabial fold is then injected towards the oral commissure, and again the depth is slightly deeper so that we can build up an additional layer. At the corner of the mouth, there is generally atrophy in patients as they age, and injections just along the edge of the orbicularis oris muscle can be performed slightly deep. The injection should be performed very gently, not under a lot of pressure, so as to allow tracking under low pressure. Notice the difference between the right side, which has been injected, and the left, which is not, and still has deep folds. There is excellent soft tissue filling and only a mild redness or erythematous reaction. On the left side, the nasolabial fold is slightly deeper, and at the alar base, an additional injection will be performed with slightly greater volume than on the right. It is important to pay attention to these asymmetries. Again, the syringe is pushed under gentle pressure so that the fluid or gel slowly tracks into its natural subcutaneous positions. Massage helps to smooth out any slight irregularities. After injection, bimanual palpation from inside and outside of the mouth can help determine if there are any irregularities or areas which require additional injection. In this case, it's very smooth. Another patient has deep nasolabial folds, type 5, and can be seen here prior to injection. The fanning technique is used again at the alar base, and some of these very deep folds cannot be completely corrected by injection alone. Patients who do not desire surgery then should not be overcorrected, as it will provide an unnatural look with too much fullness. The patient can provide feedback as the injection is performed. As the needle is withdrawn, we can see the alar base has been filled on the right and not on the left. Also, the nasolabial fold is much more full after the injection. On a close-up, it is possible to actually visualize the tracking of the material as it's injected directly into the fold, with a slight color change and a slight change in the skin superficial pattern, the peau d'orange look, which means orange skin in English. Injections can also be performed in areas that are old acne scars and massage gently to smooth them out around the depth of the pit. When we look at the left and the right side, we can see the differences.